So actually, we are having another one also, Apuva. So if you allow, then I will join her in the live session.
Okay. Yeah, sure.
I'm just putting Apurva in the live.
Sure. Mhm.
Hi everyone. Hello, doctor.
Hi, Apurva. How are you?
Yeah, I'm good. How are you?
I'm good. Thank you. Thanks
Yeah.
for coming
So,
in the session.
yeah, thank you. So, I have one question. Like my grandmother who lives in India was recently diagnosed with heart failure. I'm quite concerned about her condition and I'm seeking some expert guidance. So, while she is under the care of excellence doctor in India, I am always eager to learn more about the latest advancement in the cardiac care, and particularly from renowned US specialist. So, means thank you, and can you please suggest and give me some opinion for that?
Absolutely. It's a great question. Heart failure is a very broad terminology. It has the two kinds of, mainly the medical term for it, it's called cardiomyopathy. So there are two kinds of heart failure or cardiomyopathy, where one is your heart failing. It's not pumping the blood. The heart squeezing should be it's getting very weak. That's one kind of heart failure. And the second is the heart muscles getting stiff over time. The heart should be like a balloon. When the blood comes into the heart, it should expand and then squeeze, expand and squeeze. So in the second kind of heart failure, the squeezing or the pumping is good, but the heart doesn't expand all the way. It becomes less elastic. So the pressure inside the heart goes up when the blood comes into the heart, and that makes people short of breath, and they get symptoms from heart failure. So in your grandmother's case, I'm not sure what kind of heart failure did she have, whether she had a heart attack preceding the heart failure. So those kind of things will be important to know. So if it's the first kind of heart failure where the heart function is weak, there is a cocktail of about 4 different medications that we typically put people on to see whether to give the heart the best chance to recover its function. In addition to that, we also need to make sure there is no blockage in her coronary arteries. That's the blood vessels around the heart, just to make sure, because if there is a blockage in the heart blood supply, that can make the heart muscle weak. So we need to do if she hasn't done that already, she may need, her doctors might recommend getting a angiogram or a heart catheterization or a stress test or something like that to make sure there is no significant blood flow problems. And once that's taken care of, then it's the medication. And then there are some virus infections, different kind of toxins, not in your grandmother's case, but in some individuals who use alcohol, a lot of alcohol drinks or other drugs, they can affect your heart muscle too. So those are some of, and there are some genetic conditions where this kind of heart failure problems are hereditary and run in families. So the treatment for each of those things may slightly vary depending on what the cause. But again, at the end, if your heart function is weaker, being on the right medication is very important. And then when your heart function gets really weak, we call it advanced heart failure. Then there are some devices that they may need, like one is called a defibrillator, intracardiac defibrillator. And then even if the condition gets even worse in some people, then there are some artificial heart support systems that we can recommend, and it can go all the way up to heart transplantation. Again, I'm not saying your grandmother is anywhere near to that or whatever, her clinical status, but those are the kind of things that some people may need in a way. So when you speak to an expert doctor in those kind of history, and somebody with that history, we can look at the patient records, talk to the patient, and make recommendations as would be appropriate. And heart failure is one condition where many people may not realize until it's too late, because they would think they get out of breath and they would consider that as asthma or other lung problem for a long time before the heart is being diagnosed. So the symptoms such as getting out of breath, if they start a lot of swelling in your legs or your abdomen starts to enlarge for no reason, and your weight starts to go up, even without eating much, a lot of high fat food, or not changing your diet, your weight still going up, and you start to build up fluid in your body. Those are all the common signs of heart failure. And yeah, does that answer your question, Apurva?
Yeah, yes, doctor. So thank you for your opinion, and we will follow that what you have told. So thank you for your suggestion and opinion.
Yeah, one more thing I would suggest is then she should, along with the medication, routine exercise and watching the diet. If she's most of us in India like salt, so if she is someone like that, maybe you should cut down the salt intake, and also don't drink a lot of fluid. That can all, if she does that, it can make her retain more fluid, and then she could become more symptomatic, like out of getting short of breath and stuff. Okay.
Sure. Thank you so much, doctor. Thank you for your opinion. Thank you.
Yeah, thank you, Apurva.
Thank you.